A swim. That's all it was. 1 year later, something inside him began to hatch. At first, doctors thought it was a kidney stone. They were wrong. What they found was alive and multiplying. The real threat? It had been growing inside him all along. He thought it was just a swim. A year later, something was laying eggs inside his bladder. The man we're talking about was young, 25, full of energy, and a civil engineer from Morocco. He had spent the last year working on a dam project in Mauritania. It was hard work, but he loved the challenge. On weekends, he would join his co-workers at the nearby river to cool off. One afternoon, he took a long swim. Nothing unusual. The water was warm, refreshing, silent. A few months later, back in Morocco, he noticed something strange. A dull ache in his lower abdomen and a faint pink tint in his urine. He brushed it off. Probably kidney stones, the doctor said. Common in this part of the world. He took painkillers, drank more water. Weeks passed. The blood got darker, the pain sharper. He went back to the doctor. They ran tests, found nothing. Until a cystoscopy, a camera through the urethra, revealed inflamed bladder walls. A biopsy followed. And that's when the real story began. The tissue sample showed something almost alien. Tiny, oval-shaped eggs surrounded by angry red inflammation. His bladder had become a nesting ground. He wasn't battling stones. He was battling life forms. The diagnosis? Urinary schistosomiasis. And here's the twist. This wasn't a rare tropical condition anymore. This disease is quietly spreading, thanks to global travel, irrigation systems, and climate change. Schistosomiasis, also known as bilharzia, is caused by a parasitic flatworm, Schistosoma hematobium, and affects the urinary tract. Globally, over 200 million people are infected with some form of schistosomiasis. Roughly 112 million of these are infected with the urinary variant, mostly in sub-Saharan Africa and parts of the Middle East. But it's not limited to those areas anymore. In fact, in certain high-risk regions, especially among children, infection rates can reach over 60%. Some schools in endemic zones report that nearly every child shows signs of exposure. Think about that. Entire generations are growing up with parasitic eggs embedded in their bladders. And yet, awareness remains shockingly low. You don't need to eat contaminated food. You don't need to drink dirty water. All it takes is one swim, or just wading through shallow freshwater, in an infected area. Here's the terrifying part. The parasite's larvae, called cercariae, are released by infected freshwater snails. They detect human skin, latch on, and bore their way through. No pain, no itching. You don't even notice. Inside the bloodstream, they travel through the lungs, liver, and eventually settle in the venous plexus of the bladder. There, the adult worms, always male-female pairs, begin laying hundreds of eggs daily. Each egg has a sharp terminal spine. Some pass out through urine, but many get stuck in tissues. That's where the real damage begins. The first sign? Hematuria, blood in the urine. But it's often dismissed as minor trauma or urinary infection. Other symptoms include painful urination, increased urinary frequency and urgency, lower abdominal pain, and, in severe cases, obstruction of the urinary tract. But the real danger lies in the body's immune response. It forms granulomas, clusters of immune cells, around trapped eggs. Over time, these granulomas scar and calcify tissues. The bladder loses elasticity. Fibrosis spreads to the ureters and kidneys. Hydronephrosis, swelling of the kidneys, can follow. In men, the seminal vesicles and prostate may also be affected, leading to infertility. And then, there's the most feared consequence: cancer. Schistosoma hematobium is classified as a Group 1 carcinogen by the International Agency for Research on Cancer. Why? Because chronic infection leads to squamous cell carcinoma, an aggressive and rare form of bladder cancer that's directly linked to parasitic infestation. Studies show that areas endemic to S. hematobium have bladder cancer rates significantly higher than average. In some regions, this parasite-related cancer accounts for up to 75% of all bladder cancer cases, a parasite causing cancer. Let that sink in. Diagnosing schistosomiasis is surprisingly simple if you know what to look for. A urine sample collected around midday when egg output peaks is examined under a microscope. The eggs of Schistosoma hematobium are unmistakable, oval with a terminal spine. Additional tools include cystoscopy to visualize lesions or masses, biopsy of the bladder wall, and ultrasound to detect urinary tract damage. But many doctors outside endemic regions never consider it. That's why misdiagnosis is so common and so dangerous. The treatment is not complicated. Praziquantel, a cheap oral medication, is effective. A single dose can eliminate adult worms in over 90% of cases. In mass drug administration campaigns, millions of children in Africa are treated annually. However, the drug doesn't reverse damage that's already been done. If fibrosis or cancer has set in, the consequences may be permanent. That's why early diagnosis is critical. Schistosomiasis is a disease of water, and where there's still water, snails thrive. With growing global temperatures and expanding irrigation systems, snail habitats are spreading. Human migration and global travel mean that cases are now appearing in places where doctors have no experience diagnosing them. One study found active snail colonies in Corsica, France, yes, Europe, and confirmed local transmission of S. hematobium. We are no longer talking about a remote tropical disease. It's on our doorstep. Currently, over 700 million people live at risk of infection. The World Health Organization considers schistosomiasis one of the most neglected tropical diseases, not due to rarity, but due to lack of attention. Back to our patient. The biopsy saved his life. He received praziquantel. The egg stopped appearing in his urine. But scarring remained, and he still faces long-term follow-up for bladder health. What if the doctors had kept treating him for kidney stones? What if they'd waited longer? What if you or someone you know had a similar story? But no one thought to check for parasites. He thought it was just a swim, a moment of relief in a hot country. But one moment was enough. Schistosomiasis is the kind of threat we forget exists until it shows up in our blood, our urine, or our loved ones. So if you've traveled, if you've swum in lakes or rivers, if something doesn't feel right, don't ignore it. Sometimes the most dangerous things are the ones that enter silently and stay hidden until it's almost too late.